Do you have unsightly veins? Sometimes they can cause more than a cosmetic issue, but you can fix this. Calcagno and Rossi Vein Treatment Center on the West Shore has years and years of experience in vascular surgery procedures. Dr. John Rossi is here with us today along with patient Brent Andy. Thanks so much for being with us, gentlemen.
You're welcome.
As I was telling you before the show, I always kind of just thought of veins as a cosmetic inconvenience, but after learning about what you all do, I'm amazed at how problematic this can be for folks. So today we're talking about venous insufficiency. Explain what that is, because it sounds like a big word there.
To simplify that, venous insufficiency is a condition in which the venous blood doesn't get out of your leg because the valves in your veins don't work. So fluid doesn't roll uphill by itself, so it will roll downhill with gravity and your legs will fill up like a bucket of water, and that causes symptoms in patients. And it's a very common condition. About 27 million patients in the United States will have symptoms from varicose vein disease or venous insufficiency, and unfortunately only 2 to 3 million will ever get referred for or seek treatment. And it's very easy to treat today. It's done non-invasively. It's in the office. There's basically no downtime. No more incisions or anesthesia. It's done through needle punctures and with catheters, basically allowing patients to be treated in a simplified way that gives them almost immediate relief without any morbidity associated with it.
We were looking at a photo, maybe we can put that back up on the screen, before and after, of one patient who was dealing with a very significant issue, and you and your partner, Dr. David Calcagno, was able to treat that. So how do you treat this?
Yeah, this is this is a fairly dramatic a patient who had very large varicose veins and very, very heavy, swollen, painful legs, having had multiple pregnancies. And that patient underwent a venous closure and an adjuvant, what's called a microphlebectomy. Both of these are non-invasive techniques done through needle punctures. And that was completely done under local anesthetic without sedation. The patient walked out of the office, and I believe the picture there to the right was a post-operative picture at 3 weeks.
And the difference was remarkable.
Yeah.
3 weeks, that's incredible. We're looking at how, kind of video of how you do this procedure.
Yeah, this is a venous closure. This is basically putting a catheter in the vein that is incompetent in dropping blood the wrong direction in your leg. This is done under local. The catheter is advanced, and it uses radio frequency energy to basically close the vein from the inside, and it turns it to a tube of scar, and then over time the patient's body will absorb that vein and it'll just disappear. In the old days they used to have to operatively strip that vein under general anesthetic. We don't do that anymore.
Okay, we're going to turn it over to Brent for a moment because you had this sort of procedure done. Tell me about your experience.
I had a great experience with Dr. Rossi and his staff. I mean, I was having a lot of issues, had some pain in my leg, real uncomfortable. Went in to see them. Like he said, it was a very simple procedure. Local anesthetic. I was in and out under 30 minutes. I walked around for 20 minutes after the procedure was done and drove myself home from his office. And again, his staff was amazing to work with, and had a great experience. My leg I instantly felt relief. And to this day, I mean, the swelling went down. I feel amazing. Nothing but a good experience.
Yeah, so. And you're smiling here today.
Oh yeah, absolutely, absolutely.
Y'all are going to be back with us again. What are you going to tell us about them?
I think that we'll talk about spider vein treatment and some of the other non-invasive procedures that we do in the office to treat the various conditions that are associated with varicose veins and venous insufficiency.
So again, don't have to live with it. Thank you so much, gentlemen, for being with us.
Thank you.